Good morning. I'm Professor Dr. Nuran Abaza, Professor of Physical Medicine, Rheumatology, and Rehabilitation. Today we are going to see about the examination of the elbow joint. By the end of the session, the student will be able to recognize the different anatomical landmarks around the elbow joint, elicit the normal range of motion of the elbow joint, and recognize abnormal ones, perform special tests for tennis elbow and golfer's elbow, palpate the joint for tenderness while observing the patient's facial expression. The elbow joint is a synovial joint of hinge variety. It is in between the humerus, the radius, and the ulna. As regards the superior radio-ulnar joint, it consists of the radius and the ulna. And it is also synovial of pivot variety. Here are the important bony structure that consist both joints. First, for the elbow joint, the humerus with the capitulum and the trochlea, together with the radius and the upper end of ulna with the olecranon and coronoid process. Note that the superior radio-ulnar joint consists of the radius and ulna only, and this consists the pivot joint we mentioned previously. The elbow performs a range of motion of flexion of 145 degrees and extension that is a maximum of 0 degree. And as regards the superior radio-ulnar joint, it performs the pronation and the supination. The pronation is of 75 degrees, whereas the supination is of 80 degrees. Strong ligaments around the elbow consist of mainly the medial and lateral collateral ligaments. There are two strong ligaments that keep the stability of the elbow. As regards the superior radio-ulnar joint, there is important ligament, which is the annular ligament, extending from the ulna around the neck of the radius. Note that the posterior aspect of the elbow is provided by a bursa called the olecranon bursa. Please note that the muscles acting on the elbow, on flexion, the biceps brachii and the brachioradialis, and on extension, the triceps and the anconeus. As regards the superior radio-ulnar joint, we have on supination, the supinator and the brachioradialis as well, and for pronation, the pronator teres and pronator quadratus. Let's start the examination of the elbow joint. صباح الخير.
صباح الخير.
اسم حضرتك يا فندم؟
سيد سالم.
أهلا يا أستاذ سيد. ممكن نكشف على مفصل الكوع عندك النهارده؟
تحت أمرك. ممكن يا فندم.
شكرا. On examination of the elbow joint, let's start first by inspection. We should expose both elbows to compare the uninvolved joint, and we should inspect for sinuses, scars, swellings, for carrying angle, and for muscle wasting. The carrying angle should be inspected. It is the angle between the long axis of the arm with the long axis of the forearm. It is usually 170 in males, 167 in females. It is important in clearing the hips in swinging movement and in carrying objects, and it disappears on elbow flexion. Upon inspection from the lateral side, we should inspect for any deformities, any flexion deformities, or any abnormalities in the elbow. From the posterior aspect, you should also inspect for sinuses, swelling, muscle wasting, rashes, rheumatoid nodule, or psoriatic plaques in the elbow. Coming to palpation, you should palpate the temperature with the back of your palm, with the dorsum. And you should palpate also for tenderness or crepitus during movement. As regard tenderness, you should inspect the lateral epicondyle for lateral epicondylitis or tennis elbow. You should also check for tenderness of the medial epicondyle for the golfer's elbow or medial epicondylitis. You should inspect for the biceps tendon, and you should inspect for the ulnar nerve in its groove on the medial epicondyle. You should also palpate the olecranon, especially if there is an olecranon bursa or swelling. On examination of the movement, you should check for the flexion at first. أستاذ سيد عايزاك تتني إيديك كده. The flexion movement goes to 145 degrees and is mainly by biceps and brachioradialis, biceps brachii and brachioradialis and brachialis. You should also inspect for if there is a full range of movement, and you should do a resistance. اتني يا أستاذ سيد كده. As regard extension extend till a 0 degree, meaning that it is a straight line in the elbow, and the muscles acting are the triceps and anconeus. Also, you should test for the force. افرد ايدك يا سيد، زق عليا. Coming to supination. هنتني دراعنا كده يا سيد. لا ما تعملش مقاومة ولا حاجة. هنلف ايدنا لبره. Supination is mainly acted upon by supinator and brachioradialis, and it gives a range of 80 degrees. If you want to do a resistance for supination, حاول ان انت تودي ايدك كده ناحية دي. As regard pronation normal range of motion is 75 degrees. نعمل ايدنا كده يا سيد. And the muscles acting are pronator quadratus and pronator teres. If you want to resist pronation, the patient tries to pronate while you try to supinate his hand. لف ايدك على جوه. Coming to the special test, there is a test for lateral epicondylitis, sometimes called Cousin's test, and it consists of extending the elbow. هنفرد ايدنا كده يا سيد. And trying to resist the wrist extension. زق على ايدي كده لبره لفوق يا سيد. تمام. And checking for tenderness or pain elicited in the lateral epicondyle. For medial epicondylitis or golfer's elbow, you will flex the elbow and try to supinate and check for tenderness in the medial epicondyle. Thank you.